Hey everyone, good evening, good evening. We are living well the ultimate health journey, and we'll be talking about and a little bit. Alice Boswell is behind the scenes. Angel Conway is not in tonight, and I'm Jovi Marie, and I'm here with famous Dr. Philip Zinni, and he's going to be talking about thyroid function, the symptoms that you might have, and what are some steps that you should take to normalize it. So, Dr. Philip Zini, he's an expert on this. He actually helped me with my thyroid. So, take it away, Dr. Philip.
Thank you for that kind intro. First of all, we'll talk a little bit about the incidence or prevalence or how many people have thyroid issues. That's one thing. And then the second thing is I want to differentiate between hyper, which means like an overactive thyroid, and then hypo or an underactive thyroid. And for the purpose of tonight, I'm going to specifically talk about hypo because that's the one that's far more prevalent, and that's the one that we usually tend to um, mistreat. And the reason I pause there is that mainstream medicine always doesn't get it right. And I'll tell you about a couple cases I just had this week. The prevalence, the incidence, is anywhere from about 5 to 10%, which means that out of every 100 people, about 5 or 10 are going to have some type of hypothyroid issue. And again, there's a couple of reasons why you can have it. And the most common one, and the one I'm specifically going to refer to, is a Hashimoto or an autoimmune or a subclinical, which means that you don't have the massive goiter, uh, which means like an enlarged thyroid that's trying to work so hard to get the thyroid hormone out. It's not that type. It's the one that usually gets misdiagnosed and then, unfortunately, even mistreated. So, how do you check? What are the tests? What mainstream medicine will do is they'll get what's called a TSH, which is the thyroid stimulating hormone. That's the hormone that is released by the brain to the thyroid gland when it detects that there's not enough thyroid circulating in the blood. And when we say thyroid, we're referring to free T4, and free T4 is what the thyroid produces. However, it's not the part that is metabolically active at the cell. At the cell level, it's free T3, which gets converted from free T4. So that's the active component. So therein lies one of the first ways of misdiagnosis is by doing the inappropriate test. Because the TSH could be normal or it could be kind of low normal, um, or more importantly, it could be on the upper side of normal, and people, physicians, would then say, everything's okay. Then they'll get a free T4, and again, that may be on the low side of normal, and then again, they'll package this all together and say, yeah, everything looks okay. That's one way to diagnose it. The other way is by symptoms, and these are classic. Usually, it's your hair is thinning, or quite frankly, it's falling out, or your edges of the eyebrows are thinning out, or you may notice on your nails ridges in the nails. Those are some of the signs. And then some of the other symptoms are just feeling kind of sluggish or tired, or uh, some people even have kind of what's called myalgia, which means general muscle aches. And then people could have what's called an intolerance to temperature and feel always cold all the time. And then even more elaborate ones are GI symptoms, either bloating or constipation or just not being regular. So there's a variety of things that we ask for in the integrative functional medicine world as far as what could be going on and then what could be triggering this. So once I have a pretty good picture that this really is thyroid, then I'll start doing a deeper dive into tests. So not only will I look at the TSH and the free T4, then I'll also measure the free T3 because that's the one that gets converted from free T4, which the thyroid is supposed to produce, to the active component at the cell level. And if that isn't adequate, then that's the primary reason. Then you have to ask yourself, well, why? Why isn't free T4 being converted to free T3? So that's where reverse T3 comes in. Reverse T3 is the exact opposite. It tells the cells to kind of calm down, to slow down, not be as metabolic and active, not do as much, make you feel kind of sluggish. And then there are some other tests called the antibodies. One of them is called TPO, which is thyroid peroxidase antibody. The other one is thyroid globulin antibody, TGA. Those antibodies work on counteracting that conversion from T4 to T3. So the first mistreatment that mainstream medicine usually does is give an individual levothyroxine or synthroid, which is just free T4. So they may give that to the individual. The individual numbers may correct. In other words, TSH may lower because the free T4 level is going up. But unfortunately, it's not getting at the root cause for the free T3 and the reverse T3. So, talk about 10 minutes, and it looks like there's a question. So I think this will be a good break. Can thyroid disorders mimic other health conditions, making diagnosis difficult? Of course. So the other common ones are other hormone balances, specifically in women, estrogen and progesterone imbalances, a little bit of testosterone. In men, testosterone imbalances. And then you have to think about the general kind of issues, metabolic syndrome, which means diabetes, high blood pressure, and high cholesterol. Those could kind of mimic it. But my experience has been that usually thyroid is at the base of all of that. And if I don't correct that, then I have a hard time correcting everything else. So, good question, which is another reason why you have to get to the root cause, or else you could be masking a problem and not really treating it. So, um, any other questions, Gobi, before I go on a little bit more about treatment?
Yes, Dr. Philip, we do have a question from the audience. They were asking, can your thyroid function also stop you from losing weight?
Hmm. Very good question. And the usual answer is yes. But again, most people will go to a mainstream physician, they'll do the TSH, the free T4, and the physician will say everything is quote unquote normal, not optimal, but normal. So unless that is addressed, and most people that are losing weight or trying to lose weight, I should say, are in this pro-inflammatory case. And what we talked about with the metabolic syndrome, they may have a little bit of diabetes, a little bit of high blood pressure, a little bit of cholesterol issues. And because of that pro-inflammatory state, then the thyroid can't really work as well as it could. Or more importantly, the thyroid is kind of thwarted, or the thyroid is even actually made a little bit less active. So again, for people that are trying to reduce weight, that's one of the first things I address is thyroid function, and is it really working as well as it could be?
That's great, Dr. Philip. I know that you helped me out with that, so I'm truly grateful for that one. The
Mhm.
other question that we do have also is, what are some foods that we can actually consume that would be good for thyroid function?
So there are supposed foods uh, that may not do as well um, for thyroid functions. Um, and they're called goitrogenic, or they could induce a goiter. I've never really seen that. Um, they're usually this broad class of cruciform vegetables. So things like broccoli or cabbage or Brussels sprouts. Uh, but to be honest with you, it really gets down to gut health and food intolerances. And I think that's really the biggest issue. So we talked about last week gut health.
Hmm.
Again, that's a mainstay for thyroid because it's usually inflammation. So we have to get the gut healthy. So if you avoid the foods that your body is intolerant to and fuel the body with healthy foods, foods that not only your body can tolerate, but foods that love your body back, then you'll be better off. There's another question. Are there certain risk factors that make me more susceptible to thyroid problems? So there could be a genetic predisposition, but the reality, what I've seen in my career, it's not so much a genetic kind of predisposition. It's really cultural. And what I mean by that is we're kind of brought up in a certain manner of what we eat, how we exercise. So, for example, I was brought up in an Italian family, so it was pasta, garlic bread, and some type of meat. So, not really the healthiest and pretty pro inflammatory. The only healthy thing in there was olive oil and garlic. My wife's Hispanic, so she was raised on tortillas, rice, and beans, and a little bit of protein. And again, not the healthiest. So I don't think it's so much genetics as it is cultural or maybe heritage. And it's those kind of bad things. Because if you look at a traditional Asian diet, that's pretty healthy just by the way they live and the longevity of their life. Or if you look at a traditional Mediterranean diet, and there are some areas in Italy and Greece where people consistently live beyond 100 years of age. And that's because they're eating organic foods, olive oil, fish. Things are not loaded with pesticides and um, fungicides and bactericides and antibiotics and all that weird stuff that you can't pronounce. And again, it's kind of heritage and culture. And the beautiful news about that is it can be broken, right? You can change the ways that you eat. You can change your lifestyle. So fortunately, on my side of the family, I got half of it right. My dad was very active, so he instilled in me activity of being active. Mom, not so much. So I overcame part of that with dad. So again, it's more of a cultural or a heritage thing. If your parents are really active, they're going to kind of instill that activity level and the kind of the joy of being outside and exercising on you too. So again, I think it's more cultural heritage than it is truly genetic. Does that kind of make sense?
That makes perfect sense. Yeah, because a lot of is the lifestyle basically of how you're eating, and you know, and I always said, we try to keep our culture still alive, and but adjusting the right foods, and
Mhm,
keeping the right foods too, not
mhm.
just going just with the basics of the rice and beans, but also adding that protein in there and still keeping, some of your culture still alive.
Yeah. Um, case in point, tonight for dinner, had a big salad, and then Gay made pasta, and the pasta was a lentil based, so plant based, all non-GMO, and she made her own pesto. So she grew our own basil. We used virgin olive oil, um, pine nuts that were organic, and of course garlic, and and you can't get much healthier than that.
Exactly. That sounds delicious, Dr. Philip.
Was was.
Yeah, that's the best part where you can adjust your foods and make them more creative, where you're going to keep your health in check, basically.
Exactly. Exactly. And you've got an excellent cookbook, and you've shown how you can make ethnic, classically ethnic recipes healthier
Mhm.
and and better for you. So yeah, when people tell me it can't be done, they don't want to do it because I know it can be done.
Oh, yeah, absolutely. There's always a way. And
Mhm.
to adjust a couple ingredients and just make it even much better, I think. So, Dr.
Um,
Philip, there's another question with
yeah,
Mary.
yeah.
Are there any natural alternative treatments that can help manage thyroid disorders?
So what I usually do is and unless someone is just so frustrated that they want to do everything and anything at one time, I usually start people off in a tier approach. Case in point, I have a young patient in my clinic. We call them guests. I have a young guest who came in and was having weight issues, digestive issues, and migraine. And based on the history that I took, um, I understood that there was probably a thyroid issue. Did the blood test and showed that she did have a thyroid issue. So I did the functional test to look for gut intolerance. We cleaned up her gut and put her through a detox program. Then after that, then the next thing that we did for 6 weeks were supplements. And there are specific supplements that can be used to support the thyroid so that this way you can reduce the specific inflammation within the thyroid gland. And then there are supplements on the outside that you can do and use in order to reduce inflammation. So I kind of think of the body as four quadrants. So in one quadrant, it's the inflammatory quadrant on the outside of the cell that's completely surrounding the cell. And it doesn't make a difference what cell it is. But when that inflammatory environment is overwhelming, then the cell can't function as well. So you have to kind of put that inflammation fire out. And that's what the mangosteen products do. Then on the inside of the cell, you have to worry about, is the cell detoxed? Is the cell functioning as well as it could? In other words, can it copy the cells that it needs to do that? Your body, as we're sitting here, is copying 3.3 million cells every second. So for that, there's a glutathione product. And then the next quadrant is a good core foundational multiple mineral and vitamin supplement. Because no matter how well you eat, thank you, Alice, that's for the inside of the cell, the glutathione product called Glutamist. And the body needs some type of a good foundation. No matter how healthy you eat in the United States, you're always going to need a core multiple vitamin and mineral supplement. And then the last quadrant is the immune quadrant. And again, remember we talked about that Hashimoto's or kind of autoimmune response. So you want to make sure that you can modulate the immune system and kind of boost it where it needs to be boosted or suppress it where it needs to be suppressed. And on the right hand of my screen, you see something I call Super 7. That's the immune modulator. And on the other side of the screen was the ultimate vitamin. That's the kind of the foundation. There you go. Thank you. And then that red bottle or red label bottle that kind of looks like a little mini fire extinguisher. That's the mangosteen product called Xanthomist. And then there are specific thyroid complex supplements that help out the thyroid gland work better. And then there's also supplements specifically for the adrenal glands because usually the adrenal glands aren't working as well as they could. So there's a supplement for that. So, yes, there are natural ways that you can try first. And then I usually give that anywhere from 6 weeks to 3 months. And if I'm not seeing a big difference, then I'll go to the specific medication for thyroid. Or if the individual tells me I'm feeling better, but there's some other issues going on. So, for example, in this young guest uh, heading back to university, and they're going from 10 hours of sleep to 6 hours of sleep. So, they're going to need something to help physically boost their metabolism. So I started off on a low dose, what's called MP thyroid. MP thyroid is a natural combination of free T4 and free T3. So this way, the body is getting some of the active component that can actually work at the cell level and give her a little bit of a energy boost. So that's kind of the progressive tiered approach. But some people come to me and say, I'm done. You need to do everything and anything. And for them, I'll, I'll throw everything at them and say, let's just do the full court press or whatever analogy you want to use. And we'll try everything and possibly even a little bit higher dose on the MP thyroid to begin with and to start off. Yeah, good question.
That's awesome, Dr. Philip.
So, can supplements like iodine, selenium, and vitamin D improve thyroid function? Barbara, you're doing a great job. You could probably give this lecture. So, when I do my blood test, I always check for iodine, selenium, vitamin D, and also zinc too, because zinc is um, maybe not as important as iodine and selenium and vitamin D, but it does have a minor component, specifically inflammation. So I'll also check that, and then I also check the B vitamins, specifically B12 and folic acid, because folic acid is a marker of inflammation by looking at homocysteine. So the issue is most mainstream physicians aren't going to order those tests for you. Or if they do, they're not going to know how to interpret it. For example, if they order a vitamin D and you come back at 31, and they're going to say, yep, you're normal, but you're not. You're not optimal. And we go for optimal. And optimal for vitamin D is between 50 and 80. So when you're at 30, you're what, 50% below where you should be? And for people that have any type of anxiety, depression, or mental health, behavioral health type of issues, I shoot for the 80 range and vitamin D. So vitamin D is a fabulous prohormone that helps in so many areas of the body that it's kind of like my foundational go-to, and it's part of my foundational regimen of supplements. You're welcome.
That is awesome. Those are some great points that you have touched based on, Dr. Philip.
Thank you.
So, did you want to conclude with anything else that you want to add to this?
Yeah, so I guess I, if if a physician isn't giving you the answers you need, um, then find a different physician. Unfortunately, in typical mainstream medicine, they have about 15 minutes at the very most with you. And part of that time is the physician charting and looking across a laptop at you. So you're probably not getting the undivided attention. And if you're trying to dive into one thing, you're probably not getting it. So find a functional integrative medicine physician that can help you out with this. There are also wonderful nurse practitioners out there, physician assistants that are doing this, naturopathic, homeopathic. I mean, there's a variety of physicians that can help you out. Find someone that's doing integrative functional medicine, and that'll help out. No, Bob, unfortunately, statistically, it seems like it may be lean towards women, but I was diagnosed with Hashimoto's when I was 50. So maybe it's a little bit more common in women, um, but for me, I probably see it a little bit equal, and that's because people are seeking me out. Um, so maybe that's why statistically it's a little bit more skewed to women because traditionally women will seek healthcare first before a guy does. A guy will kind of just suffer through it until they're broke and then kind of drag their body in. How often should I have a thyroid level checked once I'm diagnosed with a thyroid disorder? I usually check if I'm just starting someone off, and if they really want to be aggressive, it'll be 6 weeks, 6 weeks, 3 months, 6 months, and a year. If they don't want to be aggressive, 6 months and a year. And then depending on how they're doing, either every 6 months or every year afterwards.
Yeah, that's wonderful.
Mhm.
Hmm. Yeah, and I want to conclude, Dr. Philip. I know we're going to have a mini little video afterwards as well.
Mhm.
So we are living well with the ultimate health journey. And the website is wellbeingpath, myctfo.com /vital for life. So double check that out. The Vital for Life that Dr. Philip is saying that you should take, especially for your overall gut health and your full body health, basically. Um, any other tips that you want to add to this, Dr. Philip, before I conclude?
Listen to your body. Your body is telling you what you need. Heal yourself, and thank you for letting us be part of your healing journey of both your body and your mind. God bless you.
Thank you. Thank you so much, Dr. Philip. I'm truly grateful. Truly grateful that you helped me get my thyroid in check. And overall, double check the website, wellbeingpath.myctfo.com /vital for life. And we are living well, the ultimate health journey with Alice Boswell, Dr. Philip Zinni, Angel Conway, and myself, Jovi Marie. And we are on every Wednesday night at 8 p.m. Central Time, 6 p.m. Pacific Time, and also 9 p.m. Standard. Wait, which one is it, Dr. Philip?
Eastern, 9 p.m. Eastern.
Eastern Standard Time. Sorry.
Well, good.
So check out the video that we have right after this. Um, and we'll see you back again next Wednesday. Thank you, everyone.
Thank you.
Welcome to Radiant Reflection.
Hi, my name is Dr. Philip Zinni, and I wanted to give you a little bit of a background about the importance of glutathione. I get so many questions about it, I thought I'd put together this quick 2-minute pictorial tutorial. When you are born, you're at the highest quality point of life. So the whole idea is to maintain that high quality of your life. But what happens? You cry, you take your first breath of air, and that, amongst many others, is your body's first exposure to free radicals, which can damage your body. Then you take your first drink of water and eat food. You live in the environment. All these things produce free radicals. Even doing healthy things like exercise produces free radicals. When you sum it up, these are all the events that you naturally do by living life. So the importance of glutathione is to help soak up or neutralize these free radicals, to reduce the oxidative stress, cellular deterioration, and accelerated aging. We notice that glutathione production starts to decline about age 20. Then, glutathione production rapidly declines, and replacement is recommended by age 40. All this corresponds with the usual modern mainstream medicine lifespan downward spiral, which is about 80% of your expected lifespan, which coincidentally is where most people only spend about 20% of their healthcare dollars on themselves to promote a healthy life. Paradoxically and sadly, when you enter that downward end-of-life spiral of about 20% of your expected lifespan, that's when you're forced to spend about 80% of your healthcare dollars just to try to forestall the inevitable grave. To live beyond that average life expectancy of 76 years of age, you should invest your healthcare dollars wisely now. You want to square the curve of functional health span medicine. So this way, you're out having the time of your life, riding your bike, and you accidentally ride off a cliff and life ends, happily doing what you love to do most. How do you do that? With Glutamist, the first glutathione mist end product. Prior to Glutamist, you would come to my clinic, get an IV infusion, which cost hundreds of dollars, sometimes in some clinics up to $1,000, and get an IV started, or an injection of glutathione. And you'd often have to repeat that. I like to be on my side of the needle, not your side, so I think you would probably want to just twist and mist. So now with Glutamist, all you have to do is twist and mist, no pain, easily affordable, and at a cost that you can use